Well, we just found out that Charleston International Airport is suspending its mask requirement per a federal court ruling overturning face mask requirements for travelers. Well, this despite a subvariant spreading through some communities. Joining us with insight is Dr. Michael Sweat, director of MUSC's COVID-19 Epidemiology Intelligence Project, with more on the Ba.2 variant. It's great to have you in studio.
Thank you for having me. Pleasure.
We're in studio. We are maskless. Now we can travel maskless. But tell us a bit more about this variant. It is a subvariant. What does that mean exactly?
Yeah, it mutated from the original Omicron. So it's different and it's more contagious, about 30% more transmissible. And Omicron, the original one, the Ba.1, was also quite contagious. So this is just another mutation, another variant, another subvariant of Omicron.
As predicted.
Yeah, it's going to keep mutating. That's what this virus does.
Right. So when we're talking about this, and we kind of mentioned this before we got started, but if you're thinking about a family tree and COVID-19 being right there up at the top, and then you had Omicron and some of the other ones, so this is the subvariant of the Omicron.
Yeah, it really split into two lineages early on. The first branch got us Delta, Omega, all of those other ones that we heard about. And then Omicron came really out of the original version of coronavirus that we saw, and it split now into two, so Ba.1 and Ba.2.
So you're saying, though, it's quite transmissible. What are the symptoms? Are they similar, different?
Very, very much the same as the original Omicron. It's just more transmissible.
I see. And we're seeing this spreading more in communities in the Northeast. How many have you seen or heard of here in South Carolina?
I mean, we still have cases occurring. We're getting about 4 documented cases per day per 100,000. Of course, a lot of people now are self-testing, so those aren't being documented. But it's much lower here, and the growth doesn't seem to be changing that much right now. But in the Northeast, in New York, Pennsylvania, the District of Columbia, they're seeing really high growth rates right now.
Why do you think that is?
Well, there's a pattern of that's happened over the past several years, where it starts off in Europe. They have their waves, which they just had, and then it kicks off in the New York area and spreads out through the Northeast. And then as it gets warmer, all through the coastal areas, we tend to see our seasonal pattern that's emerging, probably due to hot weather, air conditioning, where we get inside and with other people during that time of year.
Well, it's still pretty cold in the Northeast, so people are huddling inside to keep warm. We're now exploring the outdoors a little bit more so now that it's warmed up a bit. We're having some chilly days here and there, but being outside is helpful.
Makes a big difference.
Makes a big difference,
yeah. It helps a lot.
So we're lucky here. Would you consider it to be dangerous? Is it a dangerous subvariant?
Well, I don't think it's any more dangerous than what we just dealt with in this last big wave. And that, we actually saw significant increases in our hospitalizations rate because there were so many people that got it. But we're having growing immunity in the community, either from prior infection or from vaccination and boosters. So those are adding up to suppress the amount of serious illness that we're seeing. So it's still something you don't want to get. It makes you very ill a lot of times. Many people end up in the hospital, especially people who haven't been vaccinated or also had a recent infection.
I'm glad you mentioned the vaccines because people were still getting Omicron even though they were double vaccinated, boosted, all this stuff. So are you also kind of following along that path of philosophy that getting the second booster and the third booster, is that really helpful? Should we be doing that, or are we safe with just maybe 2 shots or 3?
Yeah, one quick thing. The vaccine does 2 things, potentially. It stops you from getting infected, and it can also stop you from getting very sick. We know now that vaccines and getting infected before, the ability of the immunity from that to keep you from getting infected, it drops off after 5 or 6 months. But the vaccines are quite effective at long-term protection of serious illness. And then that'll also slowly drop off, but the booster really brings it back up, especially that 3rd dose. And I'll tell you, only about 40% of people who got the 2 doses went on to get a booster, so about 60% of people didn't. And getting that booster would be critical to keep you from getting seriously ill. So I'd highly encourage people to get boosters.
All right. Why would you say, though, that people who actually got the booster still got sick?
Well, they got an illness, but most of them did not get that sick.
Okay, so we're talking about severity now.
Yes, severity as opposed to getting infected.
Okay. Another thing I didn't want to take too much of a turn off the subject, but we were talking briefly about the fact that now the mask mandates are removed from air travel, which a lot of people are celebrating. They're happy, yay. But I noticed that when I was masked and traveling, I was not getting the colds. I wasn't getting the flus. I'm a little nervous to take my mask off now when I travel, so maybe there's something to be said for that.
Well, you can keep wearing that mask. It's not banned.
It's a personal choice,
everyone. Right. I want to say, I think we're, those sort of public health mandates, they're blunt instruments and they have a lot of impact on people's lives. So you really want to reserve them for when you're in a public health emergency. I'll say we're not in a public health emergency right now. We have a lot more tools at our disposal. We have better treatment, we have antivirals, which we need more of them, but they're in production. Yeah. We have vaccination, and we know that masks work very effectively if you get a high quality N95 mask. So there's a lot of things you can still do to protect yourself. If we keep that switch on all the time, we lose our ability to use it effectively. Yeah. So I think that's the situation we're in right now.
Okay, and what you were saying, just real quick, is that COVID is typically passed through the air.
Correct.
Airplanes have pretty well ventilated, filtered air, so that shouldn't be so much of a problem. It's the surfaces, people, that you don't want to go touching the tables and rubbing your eyes. That's where you get the colds, that's where you get the flus.
Correct.
So just
and also just pre-boarding, boarding, that's where the air's off and people crowd. So that might be a good time to kick your mask on.
That's a good point. Thank you so much, Dr. Sweat. Always a pleasure.
My pleasure.
Back after this.